Okay, so your president is unveiling a new COVID plan. I want to see what that means. I'm supposed to be in lockdown. He said there's not going to be any wide-scale lockdowns. We'll see what happens. Let's hear. I've got sunscreen all over my face because I just got out of the shower and I was supposed to be rubbing it in, so I'm going to rub it in.
Booster shots continue to be free. We've already made available 80,000 locations, coast to coast in the United States of America. 80,000 locations to get the booster. And if you want
He said earlier that like 30% of us said we were never ever going to get the vaccine. Now he's saying those 30% are now going to get it, are now saying they're going to get it because of this new variant. Where did that come from?
booster shots. I'm calling on pharmacies, and they've been cooperative, big and small, to offer more appointments.
I put on way too much sunscreen.
Including weeknights and weekends, so you can get vaccinated at a time that works best for you and your family.
It's not, I mean,
Millions of texts and emails to remind their customers to return for the booster shots because they know who got the booster shot is CDC.
Austria has locked down the unvaccinated. The minute they did that, I'm like, okay, they're going to end up doing that here. Which I don't know how I would survive that. I don't know how I'm surviving anyway. But I don't drive. I don't have money to order things. I don't have anyone to pick things up and deliver them to me. And I don't even know how I'm going to exist anyway because of my financial hardship going forward. So I was starting to believe that there's at some point going to be a situation where, or I believe this probably a year ago actually too, that at some point it's going to be a decision they're going to force me to make between continuing to survive and getting the shot or not surviving. I've made a medical decision like that in the past. I had, there was a point in time where it was get a hysterectomy or die. And I really didn't want to get a hysterectomy, but, and I sat there in the doctor's office and I was like, I really considered telling the doctor, no, I don't want the operation. And I said that to her. She's like, are you kidding? But the fact is, I decided, sadly, to do that, and I made a mistake. I should have chosen death, and I'm not kidding. So, because I knew that the reason that was my decision was because, again, I didn't have money. Had I been a wealthy person, had I lived in a decent place where had I been able to travel for medical reasons, like, you know how people do, what do you call it, medical tourism or whatever. If I had enough money in the bank, I would have found a doctor who would have done the other kind of operation where they just remove fibroids and don't take out your uterus. But I wasn't in that position in life, and I had mass health. So my option was hysterectomy or die. And I made the wrong choice. I should have chosen death. You see the life I have now. And I had already said I didn't want a hysterectomy. That's why I got those Lupron shots, because that was supposed to be a way to maybe shrink the fibroids, but it didn't work. So I had already said, you know, I made the decision once. My gambit failed, and I had to make the decision again, but I should have, again, said no. I don't understand this plan that he's talking about. It sounds just like doing the same thing and trying to make it more convenient, as if that's the problem. I don't understand. I really don't understand. There's got to be other things they're going to do, like I said, like de-incentivizing not getting it, like making life really hard for those of us who don't want to be vaccinated. You're supposed to be able to go to whitehouse.gov and check it out. If I do that, the stream will lag. But I'm
as
going to
we
do it
continue to
because
expand.
he's not saying
We know
anything
parents with
worthwhile.
children under the age of 5 are wondering when the vaccine will be available for the little ones. That's the question I most get often asked now at functions. We had a function celebrating Hanukkah and Christmas and various things at the White House. The parents coming up to me are saying, I have a 3-year-old. Is there going to be a time that can, am I going to be okay? Is she going to be okay? Or he going to be okay? And let me say this, I strongly support the independent scientific review of vaccine usage for children under 5. We can't take shortcuts with that scientific work, but I'll do everything in my power to support the FDA to do this safely and quickly as possible. When we get to that around that point, vaccinating our children is also critical to keeping our schools open.
I'm reading it. The president's plan will reduce the number of unvaccinated Americans by using regulatory powers and other actions to substantially increase the number of Americans covered by vaccination requirements. These requirements will become dominant in the workplace. So it's going to be job or stay unvaxxed, which means livelihood, or stay unvaxxed, which means life, your life.
Now you can go home when you quarantine, but rather than being sent home in quarantine, they'll be able to stay because the test will be available and regularly. The CDC will be releasing the latest science and other findings in the coming weeks so that other schools can learn from the impediments. If there's any impediments in this practice, they can learn.
I'm making sure this is the winter plan. I don't know how to make sure that this is the winter plan and not the old one.
We want our children in school, and we're going to take new steps to make sure they stays that way. But again, the best step is to vaccinate your children. Get them vaccinated. The third, this winter we're going to make free at-home tests more available to Americans than ever before. To better detect and control the Delta variant, I made testing more available, affordable, and convenient. I used the Defense Production Act to increase production of rapid tests, including at-home tests. When I came in office, none of these tests were on the market. Thanks to our actions and the work of all of you, we now have at least 8 at-home testing options, and prices for those tests are coming down. But it still isn't good enough in my view. That's why I'm announcing that health insurers must cover the cost of at-home testing, so that if you're one of the 150 million Americans with private health insurance, next month your plan will cover
requiring staff in Head Start programs, Department of Defense schools, and Bureau of Indian Education operated schools to be vaccinated. Now, can they do that to Indians? Just asking. I'm not saying whether Indians want to get vaccinated or not. I'm not talking for anybody. I'm just wondering if they can do that. Calling on all states to adopt vaccine requirements for all school employees. Is this the old plan or is this the new plan? Getting students and school staff tested regularly. I'm not okay with this. Here's why. I've been against the tests because the tests go up your nose. If I was going to try to kill somebody, I put stuff up their nose because you know as well as I do that people will die from neti pots because they use tap water, because they put the tap water up their nose, which goes into their brain, and there's amoebas in the tap water that'll eat your brains, that if you drank the water it will not, because your stomach acids will kill the amoebas, but there's no acids up your nose to kill any dangerous stuff. So if I was going to put stuff, if I was going to try to give somebody a disease, let's say, I'd stick it up their nose. This is trying to vaccinate kids under 12. I think that nature provides a good barrier for little people who should be protected, and it's called puberty. Anything you do to people who haven't gone through puberty yet better be really fucking necessary. Anything, in my opinion. any kind of drugs,
course, this
anything,
treatment to save
any kind
lives
of
and
treatments.
reduce the strain on hospitals. And we have promising new antiviral pills on the horizon that could help prevent hospitalizations and death for people infected by COVID-19. We've secured enough supply of these pills already, and early indications are that these treatments will remain
I
effective
have no
in the
problem wearing
face
a
of.
mask. I've been wearing a mask this
We
whole
don't know
time.
that for sure
I
yet,
mean,
but
I
that's
know
the
it
hope.
doesn't matter now, so I'm not even getting new ones.
And
I'm just
like
wearing the
early
same old ones all
distribution
the
of
time.
vaccines, we will ensure that these medicines will be available to
But
hardest-hit communities
in terms
as
of
well.
me sending germs out to
And
someone
then
else by
finally,
breathing or
as
talking
we've
on
seen
them,
with COVID-19 and the
I'm still
Delta
blocking
variant,
that, and I never
and now with
stopped.
Omicron variant, all that emerged elsewhere, it all came from somewhere else. And ultimately, to beat this pandemic, we need to go to where it came from in the rest of the world. We also need to vaccinate the rest of the world. America has, in my view, continues to lead in that effort. We've shipped for free more vaccines around the world than all other countries in the world combined. Every other
What the
country
hell
in
is
the
a
world.
federal
Over 280
monoclonal
million
antibody
vaccines so
strike
far to
team?
110 countries, including South Africa, where we delivered all the doses they requested. Now, today I'm announcing that we'll accelerate the delivery of more vaccines to countries that need it. Pledged to deliver 200 million more doses within the next 100 days.
I
On our
don't
way
know.
to
I
delivering
needed God or
1
Jesus or
billion,
whoever to come back and
200 million doses for the rest of the world. Let me
smite
be
this
clear.
stuff.
Without a single
All the
vaccine
iniquity and the
dose America ever sends to the rest of the
fear
world
mongering
will
and
ever come into
set
the
everything
hands of
straight.
any American.
But when I
I'll
think
always make
about
sure
that,
the right
I think
people are
about the
protected
olden
first,
times
but
and like
vaccinating the world is not just a
in
moral
Israel
tool
back in the Moses
of
days with
moral
the Pharaoh, and
obligation
it's
that we
like
have
they
to
needed
mind
help
here.
bad.
It's how we
They did get
protect
Moses.
Americans, as we're seeing with this new variant.
But the point is,
America's
they went
done our
through it,
part,
and it's like
and we'll do more.
when I
This
think,
is a
because I
global
say to
pandemic,
myself,
and
how
that
did
means
how
we're
did
fighting
we as
together.
people, with the amount of education
And
we
that
have
means
on
there
this
are
earth
some
at this point,
countries we're helping that aren't particularly
very
friendly toward us.
education,
Their populations are in trouble.
a good percentage of
To
the
their
world
credit,
has.
the scientific community,
How
particularly
have
in
so
South
many people
Africa,
just
quickly
fallen in
notified
with
the
the fear
world
mongering
of the emergence of
so
this new
quickly, and
variant.
just
This kind of transparency is to be
why are
vigorously
most
applauded
people still
because it increases our ability
sheeple?
to respond quickly to any new threats. And that's what we did. On the
Not
very
with the
day
amount
the
of
World Health
education that's been
Organization
available in the
identified
world
the new
for the
variant,
last 100 years.
I took an
It
immediate
doesn't make
step to
sense to
restrict
me.
travel from the countries in
And
South
all the
Africa.
people who consider themselves to
But
be
while we know
religious
that travel restrictions could
of
slow the
some
spread of
religion, it doesn't matter
Omicron,
which one.
they cannot prevent it. But it
You're
does
supposed
give
to put
us
your
a
faith in
little
a higher
more
power,
time to take more
not a human
precautions
being.
at home
So
to prepare. A month ago, we announced requirements that foreign travelers must be
yeah,
vaccinated
the travel
if
thing, the
entering
more
the
they
United
lock down travel, the
States.
worse the economy is going to
This
get,
week, I
and they
announced
must know that.
additional action to strengthen international
So
travel
if
rules
they
to
are,
give us more
the
time to
more
stop
that
the
they
spread and still beat the
do the
variant.
stop the spread
It
stuff,
used to be
the
that
more they're going to
international
cripple
travel flying
the
to the
world
United
economy.
travelers flying to the United States had to test negatively 3 days
So
before their departure
that's a deal they keep
from that
making,
country. Well,
and I
I'm
don't
announcing
completely understand
today
it.
that all inbound international travelers
And they're
must
doing it
test
based on this new variant,
1 day at
and they don't know shit
departure,
about this new variant.
regardless of their vaccination status or
It's so
nationality.
brand new
This tighter testing
that they have
timetable
no idea
provides
how
an
bad
added
it is.
degree of protection
So
as
why try
states
to cripple an
continue to spread
economy
the
if you don't know it's
Omicron
bad?
variant. And we are extending the
Because
requirement
even Delta,
internationally and
they
domestically
were
to wear
as
masks for travel on
cautious about
aircraft,
Delta,
trains, and public transportation
and
through the winter months. I'll
the
close with
death toll,
this.
I don't think the death toll got
Again, the
worse
actions
after
I'm
Delta
announcing
came,
are
did it?
ones that all Americans can rally behind and should unite us in the fight against COVID-19. And they come from a position of strength. We are better positioned than we were a year ago to fight COVID-19. Since day one of my administration, we've been doing everything we can to beat this virus. And that's what we have to keep doing. That's how we keep our country and our businesses and our schools open. And that's how, even with the pandemic, we've
I don't
generated record
understand.
job
I don't
creation.
understand. All we
5.6
have to
million
do
jobs since January 20th. More than any president in American
is wear
history.
masks,
We're on the track
when we're right in each other's face. And if we don't want to, enough people who would want to because they think it's a good idea should wear masks. The worst thing that's happened is people who stopped wearing masks, who used to wear masks, because they thought the vaccine made them immune and immune to passing it on, and nobody ever said that. And I'm not saying regulate, I'm just saying if everybody wants to do better, then everybody wears a mask when they're close to each other. That's all. And I'm not talking about families. I'm talking about people in shops, in places where, there's constant traffic and stuff like that. The whole movie theater thing, Broadway theater thing, concert venue, all that stuff. When you go there, you're going there to get COVID. You might be also getting a show, but you're going to get COVID because you're in a room for a long time with cootie people. And even if you all have masks on, it's going to come out the side. You're going to lower it to eat your popcorn. I mean, you're like, this movie is important enough to me, this concert is important enough to me that I'll take the COVID for a couple weeks. I'll take my chances. That's what you're doing. But I don't know. Let's see what Lester says, if he has any insights, because he read the whole thing, or somebody who's talking in his ear read the whole thing. I don't.
Particularly against the Omicron variant, free at-home testing is also part of what the president talking about, family vaccination clinics. He also, as expected, formally announced new travel restrictions for all inbound travelers from foreign countries into the U.S., a requirement to be tested for COVID within 24 hours of
That's
the
just
flight. That's a narrower window. It used to be a 72-hour window. Let's bring an NBC News senior White House correspondent. The president's remarks on the way out or not.
Just a little as you were speaking there, and I think based on the context, the president was asked about the looming government shutdown, which is Friday, and there are plans.
There's another government shutdown coming. Nobody told me.
Funding into the new year, buying more time, and the president indicating that he's talked to top leaders on that issue. While it's not a done deal, there are some pathways to avert that.
I'm gonna end the stream.
On top of everything else that's on the president's plate.
Because I don't see anything. I don't know if Kelly's going to say anything right now. I'll give her a few minutes. Plans have already been in place, like I said. Okay, new things.
Becoming a free thing available to people who have private insurance, who would then have to submit that to their insurance company to get reimbursement for at-home kits. We'll learn more about that when the specifics of how that program will work are made known to us in January, but they intend to have more testing available in community centers and available at clinics and so forth to make that more accessible.
That doesn't sound like anything to me. Does it sound like anything to you? Just more tests?
Together in clinics where you could get your child vaccinated, where dosages are different. A booster could be administered to members of the family that have already had an inoculation, or new vaccine for those who have not yet taken the shot at all. Trying to bring people together to get those shots. And new today also, the president talking about how one of the frequent questions he gets is from people who have children younger than age 5, wanting to know if there is
so it's about little kids and
the president saying he supports
more testing.
Ongoing work to study the science for when that might
That's basically it.
At some point down the line. The president also saying they're increasing the size of the federal response teams.
These strike teams, though.
That have a flare-up, a hotspot that can overwhelm hospitals, where they bring in federal.
They never should have shut down the field hospitals.
When there's a real need in hospitals, and we know how our
that's why I don't give a crap when they start. Oh, the hospitals are overwhelmed. Yeah, well, you know what? They got rid of the field hospitals in like 10 seconds. But in the major metropolitan areas, they should have kept the field hospitals, where you have massive populations. Because even if other, rural areas got overwhelmed, they could be transferred to a field hospital in a metropolitan area.
Are you seeing the medical community now coalescing around this idea that boosters are our best option at this point?
I remember how much time has not passed since they were like, oh, everybody's not going to need a booster. Do you remember? It was like a few months ago. And I was like, oh yeah, everybody needs a booster. Pretty amazing. But I'm going to go because I got stuff to do. I have to go out. But yeah, still waiting for the gulag.